Morning everyone. Today I am taking my lecture on classification of malocclusion in orthodontics. So these are my content. What is malocclusion? Need or uses for classification, systems of classification and different terminologies. In all the systems, we will be include Andrews classification, Andrews 6 keys, skeletal classification, British standard classification, canines classification, and Ackermann profit classification. So first, what is occlusion? When the teeth in the mandibular arch, which comes in contact with the maxillary arch in any type of functional relation. So it is the main concept of occlusion, which was definition was given by the Wheeler. And now what is the malocclusion? It is a condition where there is a deflection from the normal occlusion. So whenever both the teeth which from the both the arches, they don't come in perfect relationship. So there is development of malocclusion. So why there is need for the classification? So there are so many reasons for development of different type of classification. First of all is the grouping of orthodontic problem. Second is the location of the problem which can be treated for different diagnosis and treatment planning, even for comparison of different type of malocclusion, even for communication with the doctors or even with the parents, even for the documentation of the problems, and it is also used for different type of epidemiological studies. So classification is very much required in orthodontics. So how will we classify? We can do with the questionnaire, we can clinically examine, and we can do analysis of the all the record, and we can prepare the problem list, and then the classification can be developed. So there are basically they are broadly divided into two. The first is the quantitative and the qualitative types of malocclusion, and second is intra-arch and inter-arch problems. So if we consider in the qualitative method, the Anders classification, different modification of Anders classification, Simon's classification, Bennett classification, these all the classifications comes under qualitative methods. But if we focus on quantitative method, there are different indexes in that part. The first one is the PAR index, IOTN index, then all the IOTN modified index, this all comes under quantitative classification. Whenever we can talk about intra-arch and inter-arch problem, in intra-arch problem, basically we can divide into four: sagittal problem, vertical problem, rotated teeth, and transposition of the teeth. And when we comes with the inter-arch problem, it basically deals with the both arches, maxilla and mandible. So there is class 2 malocclusion, class 3 malocclusion. If we consider in transverse plane, then there is cross bite, scissor bite, and midline shift. And if we consider in vertical plane, so we can see deep bite or open bite. Now, let's discuss the first system of classification, which is the Engel's classification of malocclusion. This is a main system which routinely in day-to-day practice we are following in classification of malocclusion whenever patients comes with us. So in 1899, Edward H. Engel published his first classification of malocclusion. You can see in the figure, the first figure show which is the normal occlusion. In class 1 malocclusion, the mesiobuccal cusp of the maxillary first molar which occlude in the buccal groove of the mandibular first molar, and there is problem in the anterior teeth. If you consider the class 2 malocclusion, you can see in the third figure the distobuccal cusp of the maxillary first molar which occlude in the buccal groove of the mandibular first molar. And when we goes in the class 3 malocclusion, we can see the mandibular molar is so much ahead then the maxillary first molar. So, mesiobuccal cusp of the maxillary first molar, which occludes in the groove between mandibular first molar and the second molar. So, we can see in this flow chart, there is class 1 malocclusion, class 2 malocclusion, which is further divided into division 1, division 2, and subdivision. And class 3 malocclusion, which is also divided into class 3, pseudo class 3, and the subdivision. Now you can see in the figure whatever we discussed just before few minutes. This is the class 1 malocclusion and there is anterior crowding and the other discrepancies. If you see in this figure, you can see the distal buccal cusp of maxillary first molar which occlude in the buccal groove of the mandibular tooth. This is class 2 malocclusion. If we focus on class 2 division 1 malocclusion, the molar relationship with class 2, but the upper incisors are procline. There is increased overjet. There is retrognathic mandible. This all comes in class 2 division 1 malocclusion. When we talk about class 2 division 2 malocclusion, it is a condition when class 2 molar relation is the same, but the upper incisors and upper incisors are retrocline. Sometimes laterals are also retrocline, and there is a procline or normally inclined canine. And overjet is usually minimal and maybe decreased. Now we talked about class 2 subdivision. In any type of subdivision malocclusion, there is one side there is class 2 molar relationship and the other side is class 1 molar relationship. So it is called class 2 subdivision malocclusion. Now when we talk about class 3 malocclusion, you can see the molar relation, the mesiobuccal cusp of the maxillary first molar which occlude into the groove between the mandibular first molar and the second molar. Now, what is pseudoclass 3? If we talk about pseudoclass 3, due to some occlusal prematurities, when mandibular moves from the rest position to the occlusion, it slides forward. So, patient tries to force his or her mandible forward. So, it's a postural problem. So, it is considered as a pseudoclass 3 malocclusion. Now, class 3 subdivision. It is a condition when one side this is a class 3 molar relation and the other side there is normal class 1 molar relationship. Now, there are some advantages and disadvantages of or the limitation of this classification. The advantages are which is very easy, it is rapid, it requires no more instrumentation, it is very easy to communicate and widely used worldwide. But what are the disadvantages? It is an incorrect hypothesis. They only measure the sagittal dimension. It is not applicable to deciduous teeth. This classification doesn't discuss anything about the soft tissue. Even the skeletal problems are also not considered. And whenever the first molar is missing, so this classification cannot apply. These all are the limitation of this classification. Now, so due to overcome all these limitations, there are two modifications were given. The first one is the Leicester modification and second one is the Davis modification. In Leicester, he introduced that there are three names. He introduced retroocclusion for class 1, distocclusion for class 2, and mesoocclusion for class 3. So, in Davis modification, he has given for class 1 and class 3 because class 2 is already further subdivided. So, in Davis modification for class 1, its molar relation is class 1, but crowded maxillary anterior teeth. In type 2, procline maxillary incisors. In type 3, anterior frostbite. In type 4, posterior frostbite present. And type 5, mesio version of the molars. In class 3 modification, in type 1, there are well-aligned teeth and dental arches, but edge-to-edge relationship. In type 2, crowded mandibular incisors, and in type 3, crowded maxillary incisors. Now, when we talk about malocclusion, we need to learn about Andrew's 6 keys of the malocclusion, which was given in 1970, in which they have 6 keys and the 7 was added by Bennett and McLongis. The first one is the correct molar relationship. Second one is the correct crown angulation. Third one is correct crown inclination. Fourth is no rotation present. Fifth is the teeth in the tight contact without any of spacing. Six with the occlusal plane and curve of speech should be flat. And seven is there is no tooth size discrepancies. So these are the Andrews 6 keys of the normal and the ideal occlusion. Now, when we talk about skeletal classification, it is divided into class 1, 2 and 3. But it is basically this classification of the maxilla and mandible with the anterior posterior relationship. In class 1, maxilla and mandible both are in harmony with each other. When we talk about class 2, the maxilla lies ahead than the mandible. So there is a prognathic maxilla or retrognathic mandible or combination of both two. In case of class 3, the mandible is forwardly placed and maxilla is backwardly placed. So maxilla is retrognathic, mandible is prognathic, or combination of both. Now, there is a pretty standard classification which is used to classify the incisor relationship, which was given in 1983. In class 1, the lower incisor edges which occlude with the immediately below the cingulum of the maxillary anterior teeth. In class 2, division 1, the upper incisors are proline. So, incisor edge which place behind the cingulum, and in class 2 D2 there is upper incisors are retrocline, so overjet is minimal and which is decreased. In case of class 3, the lower incisor edge lies ahead to the upper incisor edges, and overjet is reduced or it is reversed. Now we talk about canine classification. In canine classification, in case of class 1, the mesial slope of the upper canine will coincide with the distal slope of the lower canine. When we talk about class 2 malocclusion, in which there is a distal slope of the upper canine, which occlude with the mesial slope of the lower canine. And in case of class 3, the mesial slope of the upper canine, which lies behind the distal slope of the lower canine. Now, there is another system of classification which was given by Simmons in 1926. He has divided the arches in according to the three anthropological planes. The planes which he used was the Frankfurt horizontal plane, orbital plane, and the mid-sagittal plane. When we talk about Frankfurt horizontal plane, it helps to detect the deviation in the vertical plane. You can see in the figure, if any dental arch which is closer to this plane, it is called attraction. And if any arch is further away, which is called extraction. Now, when we talk about orbital plane, if you can see, this will show us any deviation in the transverse plane. So, if any dental arch which is more anteriorly placed, which is called protraction, and any dental arch which is more posteriorly placed, which is called retraction. Now, the third plane, it's a mid-sagittal plane, which is used to detect any deviation into the sagittal plane, which is same like the angles classification. So, any dental arch which is closer to the mid-sagittal plane, which is called contraction, and if any further away, which is called distraction. Now, there is another classification which is called Ackermann and Profit classification, which was given in 1960. It was usually proposed to overcome all the drawbacks of the angles classification because it is divided, it is given in the Venn diagram, and which includes also angles classification and also the other characteristic. Let's see the figure. This diagram is very important, and this describes the all Ackermann profit classification. You can see there are numbering 1, 2, 3, 4 and 5. In number 1, you have to consider dentofacial appearance. So whether any patient's face is symmetric or asymmetric. First, we have to check the symmetry of the patient. Then second thing we need to check, you can see on the left side, you need to check whether the patient's face is proportionate or not proportionate. So you have to measure the upper half, middle half and lower half of the face. Now, when we talk about the profile, you have to check the patient's profile, whether the patient's profile is concave, convex or straight. Then you need to check the patient lips, which are protrusive, normal or intrusive. And after that, you need to check the incisor display, which is excessive, normal or inadequate. So this first dentofacial appearance, we have to check extraorally, and which will very important while describing the malocclusion. So it will also show the all the soft tissue relationship of the patient's face. Now, second thing, when we come with the teeth and the arch form. In the teeth, we need to check whether the teeth are aligned or not. So if they are aligned and following the normal curve of the arch, then they are normal. If there is not aligned, so there might be spacing, there might be crowding or anything there. So you can see in the yellow color. In the right side, it is written spacing or any symmetry. The left side, it is written crowding or asymmetry. So you need to check the arch form, whether it is symmetric or not. So after dentofacial appearance, you need to check the patient's teeth and the arch form. Now comes to the third one. You can see the transverse. In that, you have to check the patient's arch, whether it is wide or narrow. And you need to check also it is a skeletal problem or dental problem. Then come to the fourth one. It's a sagittal relationship, means antero-posterior relationship. It is the same as the Engel's classification. So you have to check the patient has class 3 or class 2 or class 1 molar relation, and you need to check dental and skeletal relation also. So the fifth one, you need to check the patient's vertical problem. So whether the patient has open bite or deep bite. If there is any open bite or deep bite, whether it is skeletal or dental, you need to check. So according to all these three problems, transverse, sagittal and vertical, the abnormality is divided into your role and pitch. So this is very important thing, and this classification which overcomes all the problems with the Engel's classification and the Simon's classification, because they have included all the dentofacial appearance, teeth, transverse problem, vertical problem, sagittal problem, and also the soft tissue problem and the symmetrical problem. So this is the ideal classification to describe any malocclusion or any problem of the patient. Thank you.